Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Liquid Green Health Show with your hosts Fred and Janet Cox right here on Reality Radio 101. To get on board, send us an email. Our email address is liquidgreenhealthshow@gmail.com. And now, ladies and gentlemen, right to your hosts of the Liquid Green Health Show, Fred and Janet Cox.
And good afternoon, and I'm saying this with a smile. A stressful smile. Good afternoon, and welcome to the Liquid Green Health Show. A warm welcome to all of our listeners and viewers tuning in across Canada, the United States, and other regions around the globe. We are the Coxes, and we are excited to have you with us. So sit back, relax, and get comfortable as we guide you through the next hour of edutainment designed to inspire and then energize your journey towards a vibrant and healthier lifestyle. We love your comments, folks, so we're asking you to continue to keep sending in those comments via email. And let us know where you're listening from. You can send it to liquidgreenhealthshow@gmail.com. That's liquidgreenhealthshow@gmail.com. And boy, what kerfuffle this evening, right? Last minute, everything just went. Every single computer we touched had a problem. We had a problem with audio, and up to now I can't figure it out. Then we had a problem with video, and we had to switch from one desktop to one PC to another one, then to an Apple, and the Apple gave trouble. Now we're operating from our phones, right? But we're here, and that's the good thing. We have a doctor in the house this evening, and we're going to have a little kitchen table conversation with a family physician. As a matter of fact, not a family physician, it's our family physician. And we've decided to ask him to come on the show and talk to us about, doctorship.
Actually, I found it first.
Okay. I'll give
jumped on the bandwagon.
I jumped on the bandwagon, yeah.
But it's all about family and family physician and how we actually navigate. So that's what we're going to start.
Right. And the good thing is, it's right across the street from us. Not far. So you don't have to travel all the way into Scarborough or Mississauga to find a doctor. So,
Mississauga, that's where my last doctor was.
Yeah.
So anyway, once we introduced Dr. Emmanuel Adeogun, which nobody says Dr. Adeogun.
Nobody goes.
You
just say Dr. Emmanuel. And he's one of more than 15,000 family physicians who are working in communities providing vital medical care and health device to patients, all right? Dr. Emmanuel is a family physician at Valleyview Medical Centre here in Whitby, just across the street from us. Previously, he served as a general practitioner registrar, focusing on primary care and as an emergency medicine bank registrar, where he skillfully managed urgent cases in the emergency department, driven by a commitment to excellence. And he's gained valuable experience as a junior clinical fellow across multiple departments, including endocrinology and diabetes, youth medicine, and early care, which expanded his clinical expertise. Educational credentials include an MDBS degree, along with certifications in minor surgery, joint injection, EPALS, and ACLS, equipping him with essential skills to meet a wide range of medical needs. Dedicated to lifelong learning, Dr. Emmanuel aims to further develop his expertise in psychiatry, pediatrics, obstetrics, and gynecology, enabling him to deliver comprehensive care across diverse specialties. Welcome to the LGHS, Dr. Emmanuel. We are so happy and excited to have you here on the Liquid Green Health Show.
So, same here, Fred. It's so good to be here, Fred and Janet, and good to see you on a Sunday. Yeah.
Great. I want to just start by sharing a personal story
Okay.
with you, Dr. Emmanuel, because when in the search, like when we were looking for a family doctor, and we're in Ontario, and our listeners, Dr. Emmanuel, where most of our listeners, I would say 50% are in the US and 50% are Canadian. And I don't know what the percentage is in Ontario, and I certainly don't know what the percentage is in Whitby. But so it's from a broad spectrum to a narrow, but everybody has this experience.
Yeah.
And seriously, my doctor, somebody was calling my family friend almost. He was in Mississauga, and during COVID, nobody went to the doctor anyway, correct? So once a while, Mississauga is about an hour and 15 minutes away from where we live. We got a flyer in the mail that Valleyview Medical Center was being opened, and the big deal is they're accepting new patients. Because for those people who live in Canada, we know that many people, especially rural, they do not have access to family physicians. I also saw that you worked as a team. There was access to an endocrinologist, diabetes. There's a whole spectrum. There's a pharmacy right on that location. 3-minute walk from our house, or let's say 3-minute drive. Came in and registered. There was a bunch of people. And now I would think you are already saturated.
Yes.
So new patients have to go to someone
elsewhere.
Right? So I am truly happy that you're joining us today. Okay. And I know how busy you are, and I know that it was a challenge for you to say yes from one day in October. So folks, we're not going to waste the time. We're going to hear from Dr. Emmanuel. And so my first question is, you are a GP.
Yeah.
But it sounds as if you have done so many other things, so many other certifications. And looking also to add to that, I'd always like to ask a personal question. What got you into wanting to be a doctor? How long? Some people from birth, they know, I want to be a doctor. When did you know you wanted to be a doctor?
Well, I was born in Nigeria, and as far back as secondary school, as we call it back home, I knew I'm going to be a doctor because in our family, we've always been more into science. And for the science courses, being a medical doctor appealed more to me. So I would say that was the start. And getting into medical school, I fell in love with the art of medicine, practicing medicine, meeting different people. And that was how I got into it. Then from Nigeria, I went to the United Kingdom to further train as a family physician. And when we talk of family physician training, being a family physician, we have to deal with what we call from the cradle to the grave. So that means from when its child is born to when they grow old to when they die. So that's what a family physician does basically. Our training is quite extensive. We have to rotate through all the major departments to gain knowledge so as to understand every aspect of the human body.
And usually when somebody finds a good doctor, because I know I have shopped around, I have actually personally fired a doctor. Because, and you know me by now, right?
She did.
No, seriously, whenever you would do a test and you had to wait, I mean, with your clinic, you get a blood test done, and it's ready in a day or two as a matter of the doctor calls. I would have to call and say, is that test done? Was it ready? What did it say? They said, oh, when did you do that? And they had to go back and check. So it just sounded to me that if they could get the admin right, how are they going to get the personal care, right? So when this is probably not a good question for you to answer, but when somebody is looking for a family doctor, can you advise them as to what? What should they be looking for?
That's a difficult question, I would say, because our training are all the same all over the world, basically. For example, I trained in United Kingdom, and I'm able to practice anywhere in the world. So I can practice in Canada, so I can go to Australia to practice. I can practice in the United States as well, if I decide that that's where I want to go as well. So when you're looking for a family doctor, so usually that's why we have what we call meet and greet. So for you to, that gives you an opportunity to ask your questions, to get to know the doctor, to see if you are both compatible. So for myself, I've had to get some patients just because of our compatibility, what they were hoping for. I'm not able to provide that. So same also goes for the patient as well. So during the meet and greet, that's an opportunity to ask questions about the family physician, what they are able to do, what you expect from your family doctor, if they're able to provide those services for you. But I would say every doctor is well trained,
Yes.
especially in this part of the world. So when it comes to competencies, I doubt there's any doctor out there who is not competent or don't know what they are doing. But I think some interpersonal skill might just be a little bit different. But when it comes to the heart of medicine, I would say the knowledge is the same.
And I think it also boils down to personality, right? What's your first interaction with the physician? How you feel, if you're comfortable, if you like, the approach that the physician has taken dealing with your situation. So it boils down to, there are a number of factors that will make you one thing. And I must say, on meeting Dr. Emmanuel and choosing him as my personal physician, I feel very comfortable. So whenever I go to him, it's almost like a father-son relationship. That's the kind of relationship. That's how I feel. I feel
more like a grandfather-son, grandson relationship. Anyway,
but tell me what on an average day, right? Basically, what is it like being a family physician? What are some of the challenges that you experience?
Because just before you answer that, we also know in your bio, in your more detailed bio, you started out in an emergency room. So we know you have that experience as well. And perhaps to add to Frederick's question, how does it vary from being in the emergency room and just being in your normal day-to-day family practice?
So there are two words apart. So in emergency, I get to see a patient once, solve their problem, and I say bye-bye to them, and I might not get to see them again. But in family practice, is a whole different game. So this is someone that I have to see over and over again. And I would say the approach is a little bit different because of in family practice, continuity of care is a very big factor for us. And we make sure that we put that into play. And I never know what's going to come into my door. So I must be every time I must be ready to deal with whatever situation it is. And being a family physician is not just about the physical health. We also talk about the social health as well. For example, someone who has just been fired from their job or someone who is going through a divorce, those are some of the things that could affect their physical health as well. And getting to know them as a person, as their family physician, goes a long way in their care. Whereas in emergency situations, we don't really bother much about the social situation. We don't know if the person is going through a divorce, probably that's the cause of their symptoms. And that makes being a family physician different from being an emergency physician.
Yeah, I haven't heard about, I don't know football very well, but okay. I've heard the analogy that your family doctor is like a quarterback.
Yeah.
Quarterback is to the team. That's what the family doctor is in the healthcare space. Because we're navigating between the specialist, if somebody needs to see a gerontologist, like for the old people,
Why me? Why me? Why me?
or if you need to go to a pediatrician
Yeah.
or, any of the various specialties. Because as you just say, from the emergency room or from the specialist, they come right back to the family doctor.
Yes, true.
Right?
And he also, in his situation, also has to make a lot of quick decisions, especially about diagnosis and treatment plans and stuff like that, right? How important, how do you manage with the stress that comes with such important responsibilities when you have to make a decision that would affect the patient's outcome?
I don't think that's quick. I think that, well, I'll let you answer the question.
Yeah.
Okay. So as part of our training, there's something we call pattern recognition. And we must be able to demonstrate the ability to recognize patterns. So most diseases occurs in patterns. For example, if someone has a condition, we know the symptoms, we've seen them over and over again, and that really helps in making the decision in treating them. So usually from 1 to 2 minutes of listening to a patient, I already have an idea of the system that is affected, the system we need to examine, the sort of investigations we need to do. That's because probably that's the 500 times I'm saying that same condition all over. It's only in very rare situations whereby we might need to do some more investigations where we don't know what is going on yet. Also because sometimes disease comes in timelines. The first few months, some symptoms might show, then after some few months, we have some newer symptoms as well. And that's also determine how we manage such situations as well and manage such cases.
Okay. Is there anybody, for example, our son is in his early 30s.
Yeah.
Young, strong, healthy, apart from an occasional cold once every 2 years.
Yeah.
There's really no symptoms, no nothing. And there's so many people like that out there.
Yeah.
Should somebody at that age or even younger, does everybody really need to see a family doctor?
Yes, I would say a capital yes to that.
Okay.
And that's because nowadays we are seeing lots of diseases we see in older people, in young people right now. So just a few weeks ago, I caught a rectal cancer in a 34 years old. That's the youngest patient which I've had to diagnose with rectal cancer.
34 years old?
34 years old, yeah. So the things are changing. Nowadays, we have people in their early 20s having type 2 diabetes, which usually in the past we see it in people in their 50s. So it is very important for everybody to have a family physician and for them to do their yearly checkup. So that, because when we pick things up on time, it makes it easier to manage rather than when things are left unattended to for a very long time. So the earlier we pick things up, the better. So there are some screenings we do, some annual blood tests that could help us to prevent things from even happening. An example is pre-diabetes and diabetes. So before someone gets diagnosed with diabetes, must get to the pre-diabetes stage. And I've had quite a few patients, young people, who we have been able to pick this up early. And I've been able to guide them what they should do. And now we are getting a reversal of the pre-diabetes going back into normal. So everybody should have a family physician and everybody should do their annual checkup. Yeah.
Now, can I ask you a question, doctor? What is considered pre-diabetic?
Okay. So when it comes to the diagnosis of diabetes, we have some particular figures that we look at. So the commonest is the HbA1c, which tells us the average of the patient's blood sugar over the past 3 months. Once the HbA1c gets to a value of 6.5 and above, we consider that diabetes. Between 6 to 6.4, that is pre-diabetes. So if we're able to pick this up at between 6 to 6.4, we can guide the patient what they should do, their dietary modifications, just to make sure that we get this back to normal.
There's another question when it comes to male doctors, female doctors,
Okay.
and preference for patients.
Yeah.
Are you ever in a situation where somebody's uncomfortable and you refer or Is that why in a practice there tend to be different, sexes in terms of the doctor, especially culturally nowadays?
Yeah.
How do you navigate with that? If a female culturally wants to work with another female, etc. What's your thoughts on that?
Yeah, so these are things we address during the meet and greet situations. So for my female patients, I let them know that if there is any gynecological issue that they will want a female physician to attend to, all they need to do is to let me know, and I can refer them to someone who can handle that. And in our case, we have 2 female doctors in our practice that can help them sort that out. And if they want a female physician to be their family physician, that's totally fine as well. So we don't force ourselves on people, and whatever we want to do, we make sure we carry them along. So for my training is patient-centered care. So all I need to do is to explain to the patient the options available and for them to decide what is best for them.
Okay. Now, something I have to share to our listeners. One of the reasons that I was so, I won't say adamant, but so desirous of Dr. Emmanuel coming on the Liquid Green Health Show, because we are very much, Frederick and I, we do the health show. We talk a lot about holistic medicine, right? And we always say, the caveat we say on our show, we are not doctors, we never offer medical advice. Finally, Frederick, we have a doctor on the show, a real doctor.
We can offer all the advice, right?
But we still can't offer advice because you're on radio and you can't diagnose without seeing somebody, correct? But what is your message to people when it comes to holistic medicine versus the medical medicine? And before you answer that, doctor, folks out there listening, I just want to share a story, as I said earlier. I went in to see Dr. Emmanuel and I had a cough. I had a really bad cough. I didn't realize it was that bad. And of course, what we tried? We tried ginger, we tried we tried the various holistic things that we know of. The garlic, the onion and honey. We tried the tablets, what are they called? Yes. And it 2 weeks and I wasn't seeing any success. I walked into his office, and another good thing about your office, you never have to wait if you have an appointment. I'm giving kudos to Valleyview Medical. If you have an appointment at 9 o'clock, you're never waiting more than 5 minutes. At least that's been my case. So kudos to your office.
Thank you.
I remember you saying to me, you said, I know you by now. I try to really understand my patients, and now I know you. What have you done so far? And after I told you everything you've done, you checked my ears, checked my nose, you did it, you said, no, I'm giving you antibiotics. And you know what? I went home, I bought it, and within 8 days, the thing was gone. So how do you address people holistically with, the fight against the system, and when it's really absolutely necessary, go to the doctor?
Okay. So for my training is I'm properly trained, and I know some of my patients try the alternative medicine, and some says that it works for them, but then I can't comment much on that because my training is purely medical, and if I don't have much experience with holistic, with the alternative medicine. I know my home mom, she tries that as well, but that's something we do talk about, but she still always end up coming to me to seek advice when she has tried those things and they're not helping. So what I will advise is, if you have a family doctor, it's always good to check in with them, because some of the reasons why we don't tell people much about the holistic medicine is that sometimes patients might be on medications, and when they are using other things, it could interact with their medications and it could cause problems. For example, a patient who is on blood thinners using garlic as well, that could make them more prone to bleeding without them knowing. So that's why most doctors do advise or probably tell patients that, well, we don't know much about what you are using, but this is what we know, and this is what we can give you advice on.
So
That was a well-protected answer.
So
We'll take it, but I'll also have to say this for all parties. Don't worry, doctor. We have a lot of high-quality supplements that meet FDA and Health Canada guidelines.
Okay.
They're as effective as pharmaceuticals. Right?
But my question is, personally, do you believe that the health care industry should be looking a little bit more at some of the alternative stuff? I know the government is looking into trying to get the what's the word? Trying to get them approved, certified.
Yeah.
Do you believe that's something that's lacking in the medical world? Just throwing that out.
Okay, so for me, things needs to be tested, well researched, studies needs to be carried on about anything to be approved for human use. If these things can be subjected to testing, to studies, knowing their side effects, the quantity that should be used, then I think that's fine. But we have a lot out there. We have enough research has not been done about them. We don't know their interactions with other medications. So I feel those are the little things lacking. If these things can be done, then why not? If they work, then that's all fine. Yeah.
All right. Okay, great. And did you want to take a station?
Yeah, we're going to take a few seconds to get into some email as well. We just want to let our listeners know, if you're joining us for the first time, or if you have joined us late, you're listening to the Liquid Green Health Show. We are the Foxes, and our guest today is Dr. Emmanuel Adeogun. Did I pronounce that correct? Yes, I got it. See, I'm Nigerian. Right? He is our personal physician here in the Durham region, and he works out of Valleyview Medical Centre in Whitby. As a matter of fact, it's just a stone throw from where we are. Right? So, you want to get the first?
Okay, the first email is not necessary. It doesn't not directly about the show, but it's from Mike, and Mike says, "Hey to Fred and Janet, if you choose to do so, please mention all the parents out there to check their kids' candy after trick-or-treating. Reports again have stated that people out of spite with sharp implements, tacks, nails, glass, etc. Most municipalities here in Ontario offer free X-ray screening of treats. Just a thought for your listeners. I had no idea that was a thing.
I know. Yeah, I didn't know about the X-ray, but I know that they are, lunatics out there that will put stuff deliberately, put things to harm kids.
But I have a question to you, Dr. Emmanuel.
You have to be more careful.
Kids and candy. What's the comfortable line as a family doctor for parents when it comes to candy and the children?
Okay. So there are some studies that have been reported nowadays, and some of them are linking candies to things like ADHD. So usually we tell people to do things in moderation. So if you're going to give candies, so not a lot of candies, and we don't say don't give candies, but not a lot of candies, because like I said earlier, there are conditions now happening in younger people, which we don't used to see in the past. And this all boils down to lifestyle. Our lifestyle, the things we eat, the things we drink now, lack of physical exercises. So a lot of candies. I think I don't need to say that's bad. I think it's something that everybody knows, that giving a lot of candies to children is not good for them.
And good tooth care once you've eaten all the candies as well.
And Jim says, good afternoon, Foxes. Is the doctor seeing new patients? And I believe that means Jim must be in the area.
Yeah, so Could you answer that?
You should have told us where you're calling from.
Okay, so our clinic is accepting patients. We have 2 new doctors who are still accepting patients. So Jim is welcome to visit us.
Okay, all right, wonderful. And
Yeah, go ahead. Go ahead with the other email. Yeah.
there's another one from Mary, and Mary says, what does the doctor think of iron supplements for ferritin levels that are low? Is that something you can answer?
Yeah, so for low ferritin, we prescribe iron supplements. That's what we do, and we tend to monitor that to make sure the value has changed. But most importantly, we need to identify why is the patient having low ferritin. So that is the most important step. So you need to, Jane needs to visit her doctor. Why is the ferritin low? And the cause of that needs to be investigated. So if it's investigated and it's all clear, because most times it's dietary for most people, but in some cases, it could be something serious, like colon cancer or stomach cancer. So that needs to be investigated first. And after the investigation, if everything is clear, we are more than happy to prescribe the iron supplements.
Who was it that asked that question? Mary? Yeah, it was Mary.
Yeah.
Mary, I hope you heard that answer. And if you are in the area, visit Dr. Emmanuel at
What's the address? What's the address?
That's 61916 Dundas Street East. 1916 Dundas Street East.
Yeah, so that's 1960 Dundas Street
in Whitby.
East. Yeah. In Whitby. Right?
Now, here's a question from Dave. Dave is saying, hello, Health Joe. What hospitals or hospital are Dr. Emmanuel associated with? Thank you.
Is that how it works?
Yeah, so in Canada, I'm not associated with any hospital because I'm not working in emergency medicine in Canada, even though if I want to do that, I can pursue that as well. Or in Canada, I work solely as a family physician out of Valleyview Medical Clinic.
Okay, and we have Olivia, who I think she missed the beginning of the show because she's asking again. Hello, Fred and Janet. Great guest today. How long did the doctor go to school for and where? And I think you did answer that previously. But, right? So if Olivia, go back and listen to the show in the beginning and you'll get all the credentials.
Yeah, and you could just go to Liquid Green and grab a YouTube and type in Liquid Green. Here's one from Walt. And Walt says, listening again to the Liquid Green Health Show, such great information. Thanks for sharing. Blessings to the doctor. Thank you very much, Walt. And
after Irene will take a break again, I will go back to Dr. Emmanuel. Irene says, hello tonight, Pastor John. I don't understand that. Do you ever work with physician assistants? So it's it's just on the wrong show, but that's a good question though. Family physician, the assistants, they have to get trained and they have to get trained. The resident doctors, not resident, but the practicing doctors, right?
So we have physician assistants and we do work with them as well. We also work with nurse practitioners as well. So we are all a team, and we work with medical office assistants. Some people call them physician assistants, and we also have nurse practitioners as well who work in family practices as well.
Okay, I have a specific question. Family doctor, it's somebody has been coming to you for a while, and they come for the occasional cough, cold, a screening, whatever. What exactly, if you had to write a job description for the family doctor in a nutshell, what really, I know you work with the patient, you talk with the specialist, etc. But what is it exactly you would do? Like I'm thinking of something that happens. If I bump my head, do I really need to come? Or should I only come if I feel my breast and there's a lump?
So
when do people decide to come?
So we family physicians, we are properly trained and we deal with all conditions, all conditions. For example, I have seen a lot of patients who had a fall. They come first to me. I do my assessment. If they need to go to the emergency, I tell them, well, off to emergency you go. If I feel they don't need to go to emergency, I tell them you can go home. These are the symptoms to look out for. If you notice any of this, then please go to the emergencies. Then we have lots of cases that we manage ourselves that we don't need to refer to the specialist. It's only, I would say majority of cases we see, 90% of cases, we don't need to refer to the specialist. It's only in few cases that we then need the specialist input. And even after the specialist have seen, they still send back to us to continue the care for the patient.
Okay. Because I'm kind of happy. As I said, we have listeners in the US and Canada. And if something happens to you, you don't have to worry about coming into any doctor, any clinic, any hospital in Canada. They're going to get taken care of. I believe, I don't know how true it is. Our producer Gary is online, and he used to be a paramedic. So Gary, I don't know if you can tell me if this is correct or not. But I don't know if people can just walk into their doctor because of insurance and Medicaid and Medicare and all the drama that's going on in the US with meds. Right? How important is, yes, Gary?
Go ahead with the question. I'm sorry.
Can you just walk off the street into any American facility and get?
You can. There are laws passed in Congress that no person can not be treated for something. Of course, we have private insurance there as well, but we also have government insurance, which is called Medicaid, which covers people that don't have private insurance. Taxpayers pay for that. But, you know, if you don't have any insurance, they have to treat you by law. And then, of course, unfortunately, you would be responsible for the bill if you don't have Medicaid or you don't have private insurance.
Okay, thanks for clearing that up.
Mm-hmm.
Dr. Emmanuel, in Canada, is there any issue with insurance at all?
If a patient is coming to see us in Ontario, they need to have their health card, and we are able to charge the government for that. But we have some private patients as well. We call them out of the country. Someone's grandmom is visiting them in Canada. They took here. If they come to us, they have to pay out of their pockets, and they have to talk to the insurance to get them reimbursed back. But for people in Ontario who have their health card, they don't need to worry about paying their family doctors.
I want to ask a question about kids, because kids today have a lot to deal with, a lot of information at their fingertips. They have cell phones, have TV, and all kinds of stuff that's going on. But helping them to understand health, the basic health issues can be tricky, especially for parents. What are some simple ways parents can help their kids learn about health and make good choices as they grow?
Yeah. So it starts from birth or even during the pregnancy stage, because there are some vaccines that the pregnant woman should take, and that will help to prevent some diseases from happening. Then also the way you train a child is the way they grow up as well. So I have a daughter as well. So you have to enforce that they eat their veggies, they eat their fruits, you make sure that they are well hydrated, they get all their right immunizations. And we have lots of YouTube videos as well that talks about what the doctor does, what happens in the clinic as well. These are how channels parents can help to shape on the health of their kids. And also we have the annual physical, which is a yearly check as well. Just bring them to the doctors to have their eyes checked, to have their nose checked, their hairs. This forms part and parcel of a child as they grow up. And I have some parents who even tell their mom, anytime they start coughing, please let's go and see Dr. Emmanuel. So these are little things that parents do that helps the child.
Yeah. Okay. Another specific question, because I know our listeners, I'm trying to ask a question that I think if I was listening, this is what I'd like to know. When you do a blood test, what on earth do you test? Basically, You do a blood test, there's like a million things on that sheet to check, right? And when you get a result, when you get that test result, or somebody wants it, what exactly is there some things that you just routinely check all the time, or do you just depending on the case that you check for other things?
So we have some routine checks that we do routinely, and then we have some special tests depending on the patient symptoms. But most times we do routine checks for patients, and we have some set of blood tests that we do in those cases. But there are some situations.
Like which ones are the routine ones?
No, but before you answer that, I want to know for what reason isn't vitamin D a routine check? It's a routine test. So we have to pay for it. But why is it a routine test?
Okay, so in United Kingdom, for example, we're high trained because the government pays for the vitamin D checks. We do test it routinely. But that said, everybody in a country like Canada should be taking vitamin D, including myself. So that is the general advice, that you should be taking vitamin D every day. But then most people don't take it. And I don't know why the government is not covering it. So that's not my expertise. But if you want to test it in Ontario, then the patient needs to pay for it. And the vitamin D is very important because sometimes we see people with some symptoms which we know could be related to vitamin D. And in that case, we advise that we need to test for it, even though they have to pay for it in the lab.
Okay. And thank you for that. Another specific question. When someone comes into your office and they only do a physical once a year.
Yeah.
So if somebody were to get cancer 6 months ago, do they really have, unless they know, right? What are they? So nobody knows exactly what's going on from your last birthday to this birthday when you do your physical, right? But what are the things you're looking for, or what are the things you routinely check for in a physical? That's how once a year.
Okay, so physical is they give us an opportunity to check, to examine the patient from head to toe, ask them questions about their system, about all the systems in the body. And when we do blood tests routinely, so we check for the kidney function, the liver function, we check the cholesterol, we check for diabetes, we check for the blood levels, the iron levels, thyroid levels, and usually as well the vitamin B12 as well. So those are the routine checks that we tend to do.
Okay. I wanted to mention, we had a couple months ago, we had a doctor in training. She was still in med school, and she was going through the rigors of qualifying to be a doctor. You've been a doctor for several years. You had a lot of experience, and I trust you because you're our doctor and you know you're good. Okay, folks, looking for a good doctor, Dr. Emmanuel is where you start in the Whitby area. The problem is right now, I think the government is trying to actually pay people to go to med school. They're offering grants. The Ontario government has a special program where they're giving money to people to get into med school and actually stay in the province in which you have been trained. Why do you think there's such a shortage? Back in the day, everybody wanted to be a doctor. Is that changing? And why does it seem as if being a doctor is not so much? I think now people would rather be a stockbroker, not be a doctor. What's going on there? Any ideas?
I don't have any idea why people are not becoming doctors. I can't say to that, unfortunately. But I know being a medical doctor has its own rewards, and I would say it's a rewarding career. You get to meet different people, you get to help them when they needed help the most. But as to the reason why there is a shortage of doctors, I have no idea. But then we have a lot of people growing older now. The life expectancy has increased tremendously, and that's putting a lot of stress on the healthcare system as well. Yeah.
Okay. All right. We have another email from Anne.
Kind of semi-political.
It's kind of political, and you can answer if you wish. The truth, doctor. COVID vaccine. Isn't a vaccine supposed to prevent a disease? We have polio, polio vaccines, whooping cough vaccines, etc., and they prevent the disease. She left it open-handed. Any comments to that email?
When it comes to vaccines, we have different types of vaccines, and of which COVID is one of them. So we have numerous vaccines. And what vaccine does is that they mimic the virus or the bacteria, but without actually causing the disease. So our body have its own defense system. So anytime they notice there is like a virus in the system, they generate what we call antibodies to these viruses, to these bacteria, to kill them off, basically. So vaccines mimic these organisms without actually causing the disease itself, enabling our body to generate antibodies to these viruses and to these bacteria. So that is the basis of vaccination. And COVID vaccine being one of them is that it mimics the COVID virus itself, enabling our body to generate antibodies. And when the body comes in actual contact with the virus, the body is able to overcome it immediately because the body already has soldiers ready to fight off those particular viruses. But viruses are also smart, so they also mutate as well. And that's why sometimes new vaccines need to be produced, especially for the flu vaccine. So every year, the public health has to bring out new vaccine depending on the strain of the virus. So that is the basic principle for vaccination.
Personal question, really quick. Do you ever get annoyed with your patients? For example, if you were at your financial advisor and they gave you some advice and you didn't take it and then they ended up losing all their money, do you ever get upset or annoyed that you know that what you're saying is in the best interest of your patient, but they don't listen to you, they don't want to hear it because whether they're Jehovah's Witness and won't do a blood transfusion or any other reason, do you just have to bite your tongue and not say anything? Because you can't really force people to do it.
Yeah, like I said, my training is patient-centered care. In fact, my examination, some of the exams I had to do based on patient-centered care. So our job is to give recommendations to patients, let them know the possible outcome if they don't take those recommendations, and hope for the best that they could listen to us. So I've had few instances where, especially when it comes to high cholesterol, that's a big issue. Whereby due to some parameters, we recommend medication for the patient. So I've had few cases whereby I recommend medication 4 months ago to us to bring down the cholesterol levels. And in 4 months' time, the patient ended up having a stroke. And they come back to me and I said, well, we mentioned this 4 months ago. And they said, Dr. Emmanuel, you said that. So I don't get upset. I just make sure that they understand what they are doing, because all these things are going to be documented. Yeah.
Yes. I know I'm in that line because I know
she's one of them.
I know with the blood pressure. I know with the blood pressure because we hear so many stories. But you know what? After I came into you the last time and you said, well, I said, well, I take the blood pressure every now and again. You said, that's not what it's for. That's not how it works. Yeah. And my mom had, I say this on the show all the time, she had vascular dementia not caused by age, but caused by high blood pressure, which was not diagnosed. So guess what? I'm now your student. I'm taking that on.
Take the medication.
I don't feel as bad if I miss it, as I won't miss my thyroid medication, which again, I have for 10 years, I was trying to find an endocrinologist because I had been going through a series of GPs, family doctors, and everywhere I went, they changed the dosage, and I was like up and down like that. Through your office at Valleyview, I was able to find, I can never say her name because it's too long, but Dr. N. And she's an endocrinologist, and thank you, folks, my thyroid levels are now stable. So the show is, we have just less than 10 minutes.
Yeah, I want to ask this question.
Okay, go ahead. And then I wanted to just sum up some stuff
Yeah.
for us.
We're in a new season, just almost at the end of the fall, about to go into winter. Are there any tips that you can give to families to keep their immune system strong and stay healthy through the colder months? Because this is a time when people are catching just about anything. Any cold that passed, they're getting. Well, what's your recommendation?
It's amazing. We have the same basic question. So once he answers that, I'll throw a couple more, and then we're done.
Usually we advise a balanced diet, so your food is very important. Do your daily exercises, and vitamin D is very, very important. When I say balanced diet, I'm talking of eating your fruits. Your fruits gives you your vitamin C as well, your zinc, your magnesium. So eating a balanced diet, that gives you naturally all the nutrients that your body needs to fight infection. And for those who are immunocompromised, maybe there are medications that lowers their immune system, they should ensure that when they are going into public, they wear their face masks just to limit their chances of getting infection. But I can't emphasize the importance of vitamin D, especially during the winter months. Yeah.
Now, just one quick thing about vitamin D. For Black people, they should be taking more than white people. Is that correct?
So our skin, for Black people, we need a higher dose of the sun to generate our vitamin D. And if you look at nature, nature has created everything perfectly well. In the sense that if you look at where the countries where Black people come from naturally, we have high sunshine. And when we decide to move to countries like Canada with low sunshine, so we must take vitamin D at least 2,000 international units every day.
Every day.
Okay.
Okay.
You mentioned nutrition. What do you think about intermittent fasting? Yes or no? Or depends?
So it depends on what the individual is trying to achieve with their weight. If it's something that helps with that, that's perfectly fine.
Sleep, more important or less important than nutrition?
Both are equally important, I would say.
No, you should say more important because this one doesn't sleep.
Both are equally important.
There are usual reasons why people don't do certain things. So it depends on who you're sleeping with. If you don't sleep, so that's the problem, right?
Not on this side.
But sleep, what do you say? 5 hours, 6 hours, 7 hours? Do we really, as an adult, do we really need to still get 8 hours sleep? Is that a thing?
For an adult, we usually say 6 to 8 hours is fine.
It's fine.
What about water? Water, how much? That's the biggest question.
This eight glasses per day, is that really true, or is it a myth?
So we talk of minimum of 2 liters of water per day. And
2 liters.
2 liters minimum. And for bigger people, they need to drink more. So it depends on
tea. Does that compensate for water?
What's that? I didn't get that.
If you drink tea, let's say you have 3 cups of tea during the day, and then you only have 3 glasses of water. Does that really make a difference?
So when we talk of water, we still want the 2 liters of water per day. We still get our water from other sources, like the food we eat, they have some moisture content in them as well. But when it comes to water, we still talk of minimum of 2 liters per day.
Okay.
Okay, well, thank you
Yeah,
so
this,
much.
folks, I hope our listeners had pen and paper to really take down some of the tips that we got. You're listening to the Liquid Green Health Show. We are the Coxes, and our guest is Dr. Emmanuel Adeogun, and he is practicing out of Valleyview Health Centre in Whitby, Ontario.
And they're
taking new patients. So if you live in the area and you want to get a good doctor, visit that health
facility.
center.
And we have just another quick email just coming in. Hello, Janet and Fred. What a good show today. Such good answers. Thanks for this guest. Please have him on again.
So you heard that. You
Eric?
heard that. You heard that.
Eric, we will try to get him on again in the new year.
Yes.
Because I know this schedule.
Not easy. Not easy.
And so with that, we're really honored.
We're honored. Yes. Really,
and
really.
We're
happy to have you on. And, so listen, thanks for lending us your time.
Thank you for having me.
I don't want to say it, but
and I want to say this. It might sound terrible, but I want to say it. I am really happy that you're on the Liquid Green Health Show. Because who do we know? We know the people we work with. I actually asked our dentist.
Yeah.
I won't say any names, but it's also a local dentist. And you know what? He promises, and everybody is busy and would not. So that's it. Guess what?
Find the time.
I now have a new dentist. It sounds vindictive, but we're here to
if you can't take the time to come to speak to our audience, we are your patient.
Community.
Yeah,
it's not about personal. There's no profit. There's no gain to us.
Yeah.
Very little to do. It's just that we have answered a lot of questions to some people who really don't even have a family doctor.
Yeah.
So thank you so much. And Frederick, with that,
you're going to turn it over to me. Well, we don't have any more email to answer.
No.
Okay.
Good.
That's it.
Mm-hmm.
Well, folks, this has been a wonderful conversation. I told you we were going to be having a kitchen table conversation, and that basically is what it was. So once again, I'd like to thank Dr. Emmanuel for coming on to the show. And with that, we'd like to end our show with our usual quote, and that is, good health is the cornerstone of human happiness and well-being. It not only enhances our quality of life, but also drives prosperity and economic progress. Healthy individuals tend to be more productive and may even enjoy longer lives. So, until next Sunday, same time, same station, this is Janet and Fred reminding you to let's stay healthy on the Reality Radio 101.
Thank you for listening to the Liquid Green Health Show with your hosts Fred and Janet Cox, right here on Reality Radio 101.